Good afternoon, good evening, everyone. Thank you for joining us today. We are here, this month is Head and Neck Cancer Awareness Month, and we are here talking today to Mr. Sunil Issar. He is a mouth cancer survivor, an entrepreneur, and a cancer coach. And I'm Aparna Mittal. I'm the founder of Patients Engage. Quick reminder for people, Patients Engage in an online platform where we believe that patients and caregivers should be informed about disease management, about care for chronic conditions, and they should be engaged proactively in in learning about the disease and proactively managing it. And the more information they have, the more empowered they will be in dealing with some of these complex conditions. As a result of that, we've over the years put out, especially for cancer, a bunch of webinars, which puts patients and survivors at the center of discussions, because we also believe that you not only learn from the healthcare professionals, but you also learn from experiences of people, lived experiences of persons living with the condition, lived experiences of their caregivers. And again, it's not just medical information. You need to understand the other aspects of living with a condition. We've also talked of how living with a condition impacts other relationships that people have, with their family members, with their loved ones, with society at large. And specifically on head and neck cancer, we've done a few topics before, which you can find on our, you'll find these videos on our YouTube channel. So we've talked about, dealing with changed appearances in head and neck cancer, as well as, with a plastic surgeon. We've talked about the role of caregivers when they're looking after a person with head and neck cancer. We've talked of the importance of tobacco cessation, and also how it's important to understand that you may sometimes need psychological counseling support as well, or you may need peer support. And similarly, we've also talked to other survivors and cancer rehab. Reminder to the attendees that the information that is being discussed here does not replace a medical consultation. So please consult your doctor for specific medical issues. This session is being recorded. If you're logged into Zoom, you can post your questions on the Q&A. Give us a thumbs up, give us your comments as you go along. And if you're on Facebook, YouTube, you can post your comments on the live feed and we'll pick it up. And we'll ask the question to our guest today. And if you have an experience to share, you can always write into us at editor@patientsengage.com. And our social media channels, we are on YouTube, Twitter, Facebook, LinkedIn, Instagram, and the website is patientsengage.com. So quickly introducing our our guest today. He's a patient advocate, he's an entrepreneur, he's a cancer coach now, he's a mouth cancer survivor, and he will in a short while tell us a little bit more about himself. He's had cancer many years ago, and he's a living example of the fact that you can recover from cancer, as well as you can live with all of the issues and figure out how to deal with them as you go along. So do shoot us your questions. We will start off with the discussion and we will take your questions as we go along. So thank you, Sunil, for joining us today. And if you can, I did a very one-line introduction about yourself, but if you can tell us a little bit more about yourself.
Thank you so much, Aparna, and good evening from a very hot Noida. My name is Sunil Issar, and I am now 56 years old. I was diagnosed with cancer just before my 40th birthday in September 2006. I used to have a beard and good teeth, didn't see a dentist. So a lot of symptoms got hidden below my beard and in my mouth, and I was blissfully unaware. I was living in Chennai at that time, and the hot and humid weather of Chennai, in any case, saps your energy. So I never thought of it as anything different than it just being the weather. Until one day when, pulling the skin to straighten out my beard, I felt a lump under my jaw. And I had a fairly, good gut feel about what it might be, but I decided to play innocent and go to a general practitioner at a hospital next to my office. And I asked him, I said, what is this? So he promptly, of course, sent me off to go and get a biopsy. The doctors also had one look, and even before they'd done the biopsy, they said, yes. So, but we will wait for biopsy. So, okay. 3 days later, I had a biopsy, which told me that I had a stage 3 cancer of the mouth, the lining of the cheek, to put it in very simple terms. And that is really where my cancer journey started. And well, that was a long journey. It's now 16 years since then. Of course, the doctors did what they had to do, and they did a very good job, which is why I'm still here. But there was a lot that I had to do both mentally and physically to ensure that I am able to continue to function efficiently even within the limitations that this cancer has caused me.
Right.
For instance, if you notice, even now while I'm talking to you, if you notice my mouth doesn't open very wide.
Correct.
And that's just one of the many things that I'm sure that Aparna and I are going to discuss today. But yes, mouth cancer is one of the most visible cancers that anyone can get. Most of the other cancers are hidden either under your clothes or inside your body. But this is one of the cancers that is very, very visible. You can't hide it.
Yeah.
So, you've got to live with that. You've got to live with the questions. I'm very good at answering questions.
So let me get started with some questions.
Yes. So, Aparna, back to you.
Yeah. So, you said you got a diagnosis. Did you just start on your treatment there and then, or did you seek a second opinion?
Well, I was diagnosed in Chennai, and the course of treatment that the doctors there were suggesting somehow didn't give me too much of comfort, because I think the doctors there had a very had an approach to say that we know everything, you know nothing, and you just quietly do what we tell you and go to the dentist tomorrow and we're going to remove all your teeth. And then we're not going to do anything for 2 weeks while you undergo tobacco cessation. So I said, but why do I need to do that? I'll stop smoking immediately. No. As per our protocol, you have to 2 weeks. I said, I don't have 2 weeks. So in that discomfort of the way the doctors were dealing with me, I desperately started looking for a second opinion. I reached out to a cousin who had unfortunately lost his wife to cancer very recently at that time. And he spoke to his doctor friends in Calcutta, and I got a reference to a doctor in Bangalore, which is not far from Chennai. And he had recently returned to India after practicing in Europe for about 30 years. I was able to get an appointment to meet him. And I went to him for a second opinion with the papers and the biopsy report and all of that. This gentleman sat, he spoke to me for about 5-10 minutes just to evaluate perhaps my state of mind and what I was going through. And he started drawing a diagram of my face, and he explained where is the cancer. If he was my doctor, how would he treat it? And everything on a diagram, very participative. And at the end of about 45 minutes, my only question to him is, please check your diary and when can you take me in for surgery?
Right.
And he also told me, he said, I'm not just going to do surgery because you're young, otherwise all your other physical parameters are good, despite the fact I have a weight issue. but apart from that.
Mm.
And so, I'm going to do the surgery. I'm also going to do radiation. I'm also going to do chemo. But the radiation and chemo will be more preventive
Mm.
post-surgery. So
Right.
that all sounded very good to me because that doctor gave me immense confidence in his own ability.
Right.
And the fact that it was a hospital that only dealt with cancer.
Right.
In my mind, that was one thing that was almost a prerequisite, because I was aware that with cancer your immune system is compromised. There's a higher risk of picking up other diseases in a hospital. So I thought a hospital that's only onco
Mm.
actually improves my odds of not getting another
Contracting some other
hospital
condition.
related infection. So
Right.
yes, I was very happy about that. And so I finally had my treatment in Bangalore.
Right. And you talked of surgery. Did that include reconstruction surgery as well?
Yes, it was one single surgery of 12 and a half hours under anesthesia, where the onco surgeon team removed 14 lymph nodes, just to give you an idea, right up to my right shoulder. Two had exceeded the margins.
Mm.
So to be on the safe side, right up to my shoulder, they removed all the lymph nodes along that branch. And then the plastic surgeon team came in the same surgery and reconstructed my face. So I was under anesthesia for 12 and a half hours. This incidentally was 5 days before my 40th birthday.
Mm.
So I ended up spending my 40th birthday in the ICU recovering. And yes, so I had one single sitting of surgery where for both to remove the cancer as well as to have the reconstructive surgery done.
Right. Right.
And a graft was taken from my arm. I don't know how.
Okay, that's the idea.
Yeah,
We can see.
you can see here with the blood vessel.
Right.
So the graft was taken from here to do the inside of my face. The right side of my face is reconstructed.
Mm.
And then a graft from the thigh taken to replace the skin on the arm.
Mm.
I asked the doctor, I said, why do you take it from the arm?
Mm.
So he said that this is the part of the body which has the least fatty tissue.
Right. Right.
The thinnest skin is actually on your
On the
forearms.
right.
And that is why they take it from there. Because
Mm.
I had a couple of wacky jokes about why don't you take it from my bum and all of that, but the doctor
Right.
didn't appreciate all of that. Yeah.
Right. Yeah. So, I mean, yeah, unfortunately, as a result of the fact that they have to align it, you end up having more sites of surgery, right? So
Yes.
did that cause any, any issues, any healing issues, etc.?
No, I think I healed very well actually. In as much as with all the surgery, my face post surgery was twisted entirely to the right. I'd say that the right side of my face was probably about this, at least about 4 inches
Right.
more expanded than it is now.
Mm.
So it was a very displaced, unsymmetrical alignment,
Right.
and covered in dressing on the face, the arm, right up to the neck. So it was initially caused some discomfort, but I think the third day out of the ICU, the doctor said that now start doing a little walking.
Mm.
The moment I could get both feet on the ground, and with the help of my family and the attendants and all, had a little bit of walk, got the blood circulating again. I said, good, surgery is done, successful.
Mm.
Now I have to focus on recovery.
Right.
And the first thing I did as part of my recovery was I insisted that my Ryle's tube has to be removed.
Mm.
Even though my face inside my mouth was completely tender, there was no chance of, food intake from there. But somehow, like being connected to a drip, a Ryle's tube signified to me a certain level of helplessness.
Right.
Which once I had decided that, I am going to now work completely towards my recovery, it was one of the first things that had to go. And the second was that I'll take my stand with my drip and all with me, but I will go to the toilet. I will not use the bed bath. So even if it took me a lot longer,
Right.
but it was just one of those things that I saw as a way of normalizing my life again.
Right.
I mean, I still had dressings and sutures and all kinds of stuff, and I couldn't lie down completely because of all the pressure. So even while sleeping, I used to sort of sleep in a semi-horizontal position. And I had to sleep like that even after coming home. Probably for about 6 months, I had like 3 layers of pillows behind me, because I just didn't have the strength to lift myself up because of all the sutures in the neck. So yeah.
And did they start the chemo and the radiation right away, or was there some
pretty
time?
much so? I would say that probably as soon as the dressing sort of came off and the stitches came out, the staples came out, I was ready for radiation, which was basically IMRT. And chemo, and so I had to go and get that mesh wax mask made, so that every day when I went for my IMRT, I'm absolutely in the same position, and they can do that very, very target specific radiation.
Right.
And it used to be 5 days of radiation, 7th day chemo. 5 days of radiation, 7 days of chemo. And I think I did 8 cycles like that. So about 40 radiations and 8 chemos.
Right.
All at one stretch.
Wow. Okay.
And
that was
chemo
over what?
cisplatin. So in those days it was a drip. So each chemo session was about 4.5, 5 hours. So going to daycare and.
Right. And you did go back to work, right? You were still under 40.
Yes.
Or just turned 40. Did you go back to work after your chemo radiation, or did you go back to work during the treatment itself?
When I was diagnosed with cancer, I was working for an American company in Chennai as the Asia Pacific head for infrastructure. I went back to work once I had completed the entire cycle of surgery, chemo, radiation, which was all put together about 3.5 months.
Right.
So from the time I was diagnosed with cancer till the time I got back to work was about 3.5 months. So September to December, it was early January when I went back to work. And well, I think that was probably more traumatic for my colleagues than it was for me. Because they were used to a certain picture and a certain vision of me, and there's this new me who landed up out there, and I think probably scared and shocked a lot of people.
Right. And how did you handle that? Because for a lot of people, it is tough looking into the mirror after, a head and neck cancer. And then I guess it's, when they start to accept that, the reaction of people also kind of then gets to them.
Yeah.
So talk about both, what happened when you first looked into the mirror. And
well, once you have accepted, or once I had accepted that, okay, this has happened. Now what I look like, I could not obviously use a razor. So I used to use, now what's very common in those days, a battery shaver on one side of my face, because the other side of my face, in any case, post-radiation, no hair was growing. Till today, every morning when I shave, I actually only need to shave half my face. Because the right side of my face, no hair grows. So when I get up in the morning, I can't decide that today I'm not going to shave, because only half my face has stubble. So it looks very funny. So yeah, so coming back to looking in the mirror. the first thing I had to do was accept to myself what I look like,
Mm.
and the fact that I recognize that it will get better.
Mm.
And it's not always going to look like this, but nobody knew what the end result would be.
Mm.
I mean, a stage 3 head and neck cancer in those days, typically the average life expectancy post treatment was 5 years.
Right.
So, one thought of, okay, fine, what by 2011, I wonder what it will be like.
Mm.
One didn't really think beyond that, because I was conditioned that, okay, if that's the life expectancy, that's the life expectancy. Now, while I was still undergoing the radiation and chemo, I used to drive myself from home to the hospital in Bangalore. So I got back the confidence of being able to drive short distances. People used to stare at me in the streets or even in the hospital. I'd have little kids who'd come up, and either they'll scream or the more curious ones will ask what happened. I'd be quite happy to talk to them and try and explain to them what had happened. A lot of people thought I'd been in a really terrible, road accident.
Right.
And so the first thing was, oh, very bad accident. How did it happen? I'll say, no, it wasn't an accident, it was cancer.
Mm.
Oh, cancer.
Mm.
And that's when you realize that, people's perception of what is cancer really manifests in their facial expressions,
Mm.
And so once I had got, comfortable, and because I had to shave every morning, I had to look at myself in the mirror. So I was in a way reconciled to that face in the mirror, that yes, that's me, and I've got to now live with that.
Right.
Fortunately, the organization I was then working for in Chennai,
Mm.
I had a couple of American bosses who had come to see me while I was in hospital and afterwards. And they had, prior to my coming back to work, sensitized the team
Mm.
that I'm coming back and I don't look like what I used to.
Right.
So I think that made a huge difference
Mm.
in the acceptability, and people learn to be a little polite and perhaps not, manifest the shock or the revulsion or whatever they felt.
Mm.
And to that extent, it became easier.
Right.
For a long time, of course, I would only work out of my office. I was still on a very special liquid diet. So, of course, going to the staff canteen and all of that was not much of an option. But I think within 3 months of my joining, I started traveling abroad also again.
Mm.
Even though I didn't look like anything like my passport photograph.
Right.
But I mean, if I'm going to work, if I have responsibilities and I have to carry them out, then I just have to do it. The only place I had a problem, if I remember correctly, was Bangkok airport, where I stopped and told I don't look like my passport.
Mm.
So I had to explain.
Mm.
But otherwise, I didn't even have an issue there. Though, of course, yes, a lot of people in the airport would stare.
Right.
And yes, because of the surgery and reconstruction, even on the lip, I tend to dribble a bit on one side. So I'm not the neatest and tidiest of eaters.
Mm.
I mean, I'm okay with it, but it can be a little embarrassing for somebody who doesn't know.
Mm.
So, yes, I did. I was generally made very comfortable.
Mm.
But there were those cases where, people would sort of look at me and look away in
Right.
revulsion.
Right.
Well, one had to just live with it.
Right. So you did that as far as work was concerned. Social gatherings, when did you start going out to, parties with friends or weddings where it is, mix of known and unknown people?
Very, very,
And
very interesting question, actually. Well, I had friends coming home once I was discharged from hospital, and um, you know, I had friends coming visiting from abroad. So to that extent, yes. And the apartment complex that I was staying in Bangalore, we had a large circle of friends within that. So you could say, in a way, I was gently broken back into social gatherings with friends who were already aware of my situation. Once I'd gone back to work and I was dealing not only with my own colleagues, but with vendors and, visitors to the office and foreign clients and all of that, then it didn't really matter after that. And I wasn't going out not because of any apprehensions about my own physical appearance. It was more to do with the limitations of my dietary.
Right.
So I might go register my presence at an event and come away purely because of my dietary requirements at that time, which were still, liquid or semi-solid.
Right.
So that more than my appearance governed where I would go and what I would do.
So as far as, let's look at, talk about your dietary and eating restrictions, right? So what did it start with, and where are you at today?
Okay.
If you can describe that journey as well.
I was on, post coming out of the hospital, I was on a liquid diet which mainly constituted soups of various things. Even though my taste buds were almost zero, I had very bad dry mouth. But purely from a nutrition point of view, my wife ensured that my body would not be lacking, even if I couldn't really appreciate. I would know what are the ingredients going into the soup.
Right.
But I wouldn't be able to taste it.
Right.
And the inside of my mouth was very sensitive. So the idea was to swallow quickly and not leave bits in the mouth, because oral hygiene was a limitation. It was only a bit of gargling with mouthwash and stuff like that, no brush in the mouth or anything like that. So for a long time, it was soups, whether they're vegetable soups, whether they're meat soups, but mainly the focus was on ensuring nutrition and ensuring that there's a good intake of antioxidants.
Right.
In South India, there's a particular kind of vegetable which is known as a Mangalore Sautakai. It looks like a nice round cucumber. I think it's from the marrow family, which is supposed to have very good antioxidant properties. So that would be boiled and mashed and put into all soups.
Right.
And well, it didn't do me any harm. It's very neutral taste, so it could be put in with anything. Lots of pomegranate juice, fresh, again very antioxidants. And then in one of my reviews with the doctor, I just joking and asking, I said, when do you think I'll be able to have a drink? She said, well, you can have 30 ml of red wine because it's again got antioxidant properties. So I said, yeah, this is a good doctor. He understands what I want in terms of normalizing my life.
Right.
I used to drink alcohol earlier. So he said, yeah. So for almost about a year and a half, my only beverage of pleasure used to be red wine.
Right.
Apart from all the pomegranate juice, and almost the same color. So yeah.
Did you try a cocktail of the two?
No, I didn't. I don't like to spoil my red wine. And very judiciously, 30 ml would be measured into a small glass, and that's what I would get. Right. So it was almost as part of my medical regimen and not for my pleasure. But yes, just having that made me feel more normal.
Right.
And that's something that I was craving, was to try and get my life as close to what it was before cancer.
Right.
With the exception of cigarettes.
So yeah, we'll come to cigarettes later, but in terms of you tried to normalize, you moved from liquid diet, you started, um, a little bit of red wine. Over time, when were you able to eat solids, and what are still some of the restrictions that you face?
Okay. Initially, because the inside of my mouth was very sensitive, because both the surgery and the radiation, and obviously the radiation had impacted my tongue to a certain extent, so therefore my taste buds were very hypersensitive, plus dry mouth. I initially could not even tolerate salt and pepper. Forget about other spices. Today, 16 years later, I am able to tolerate all spices, except even today, I can't handle chili. Somehow the chemical, the capsaicin in the chili, whether it's red chili, whether it's green chili, whether it's chili sauce, whether it's chili flakes, it burns my mouth even today. I'm okay with all other spices, whether it's haldi, whether it's garam masala, whether it's jeera powder, you name it, I have no problem. It's only chili. And how it manifests itself is, it'll make my nose start watering. I'll start perspiring off the top of my head. And, it just makes me so uncomfortable. So if I go out, or if I'm eating out or anything like that, I have to give very specific instructions in a restaurant. Say, please ask your chef, make something fresh, whatever he wants, but it shouldn't have chili.
Right.
So today my restriction, I would say, is chili. And even now, cooking at home, I try and put minute bits of chili into my food, purely to try and even overcome that.
This restriction.
Yes, this is where it's not really a restriction from a doctor. It's more in terms of what my body can tolerate. So otherwise, I eat anything and everything as long as it is soft.
Right.
One of the other issues with all the radiation and all, and which the doctors had told me when they started my radiation, was my teeth will be brittle. And they really didn't know how long I'll be able to retain my teeth. So as a result, I was generally conscious of not eating anything that's very hard, that could lead to breakage of a tooth. I once, very foolishly, while driving on a long drive, decided to chew chewing gum. And while chewing the chewing gum, it took out 2 of my teeth. So when I spat out the chewing gum, 2 teeth came out as well. And because I can't open my mouth, dentists have a very serious problem in doing any kind of works, especially on the right side, because there's no flex or flexibility in this cheek.
Right.
So while I can inflate my left cheek and I can stretch the left side, the right side is absolutely atrophied with the surgery. So I can't get a denture made. With great difficulty, I can get a filling filled.
Right.
So I have to be extremely careful with what I'm eating, just to retain the few teeth that I have left.
Right.
So, this is where one has to be very conscious of your limitations, of what you can and cannot do.
Correct.
And it's no point being foolish. I mean, if somebody gave me, dry roasted chana to eat, I'll say no. Because I know there's a very high risk that I'll crack another tooth.
Right.
Which is then irreplaceable. So my teeth are like gold at the moment. The longer I can preserve it, and I mean, I'm sure if I go back to the radiation oncologists who treated me at that time, and I tell them that, I probably still got 15 or 16 teeth in my mouth, they'd probably say that it's very commendable.
True.
So yeah, so that's where, as far as food goes, I eat anything.
Right.
I have no dietary restriction from doctors. I'm quite a foodie. because of my heightened taste buds, I actually do some assignments as a taster for some food
Right.
companies also. So as they say, when something closes, something else opens. So yes, so my hypersensitive taste buds do come useful once in a while.
Right. Right. So a couple of questions have come in. What is your routine for oral hygiene, given the limitations?
Yeah. Okay. Today I'm allowed to brush. So I do use toothpaste and a extra soft toothbrush to brush my teeth. Then I use an instrument called a water pick. It's like what you see the dentists have, which has got a fine jet of water. Because on this side, I cannot do kulla, I cannot gargle or rinse my mouth on this side and get the food particles out. So whatever food gets stuck between the cheek and the jaw, I actually use water under pressure on the inside with a nozzle to flush it out, so that those food particles don't get left inside my mouth, where it can then decay and cause other problems. So in terms of my oral routine, and typically in the water pick, what I'll do is I'll add a bit of mouthwash.
Right.
So normally at night, or if I've had a heavy meal where I've had some chicken or something and bits are stuck in my teeth and all, I'll use the water pick even in the day if I'm at home. And so it's a combination of an extra soft toothbrush with any regular toothpaste, and then the water pick to get out the stubborn bits where the brush can't reach.
Right.
Because between my teeth on the right and my cheek, I can't even get a toothbrush in.
Right.
So this fine nozzle with the water works perfectly well for getting out all the food particles. It's called a water pick, WATERPIK, and available with most chemists.
Chemists. Okay, good.
Or you can order it online. But it's a very useful thing to have.
Right, right.
It's also very good for people who use braces.
Right, right. So do you go to a dentist regularly now, or
I don't go to a dentist. Well, I mean, thanks to COVID, I haven't been to a dentist again for the last 2 years. Otherwise, I used to go to a dentist about once in 6 months, just to get things checked, because there's very little that they can do. But that odd filling, or maybe the half a tooth is broken, so it needs to be filed down, stuff like that. But my advice to everyone, and this is where actually I probably lost out in terms of having my cancer detected earlier. Whether you have a problem or not, it's worthwhile going to a dentist once in 6 months and just having an overall checkup. Because the dentist is the only person who can look inside your mouth, right, and tell you if there is something that is not normal there. I had not been to a dentist for 3 or 4 years before I was diagnosed with cancer, because I was very proud of my teeth, and I used to say that, look, I don't go to a dentist. I mean, I used to take it as something very creditable. Right. But in hindsight, and when people ask me, what are the learnings from mouth cancer? One of the biggest learnings is make sure you go to a dentist at least once in 6 months and just have a proper checkup. Right. It's very important. True. True. More so if you are a smoker or if you're chewing tobacco, then it is almost essential.
So talking of chewing tobacco or smoking, you gave up tobacco. How did you, or give up smoking? How did you go about that?
Well, actually, in my case, the day I got my biopsy result, I just stopped cold turkey right there. I didn't even light up another cigarette while reading the biopsy report. It might have been easier for me because I had already decided that on my 40th birthday, I was going to give up smoking. So I was already mentally conditioning myself that, okay, this is like the last 3 weeks that I'm going to smoke anyway. And then at 40, I was going to give it up. But once the biopsy report was in my hand, I just went cold turkey. I did not light another cigarette after that. Yes, for about 2 or 3 days, I was constipated. Because I was so used to that first cigarette and chai in the morning to get the morning going. But after 3 days, things came back to normal. And then the whole rush of preparing for surgery, running around, all the other paperwork that needs to be done, all of that kept me preoccupied enough that I didn't even need to think of cigarettes. For many years post-surgery, I used to still have packets of cigarettes lying in my drawer in my home. I had cigars lying with me, but I never felt tempted to smoke again.
Right.
So I literally went cold turkey and just did a dead stop. I know it's not easy for everyone.
No.
But if you set your mind to it, it is possible. I know I did it, so therefore I can very happily tell people. Today, I have that confidence that even if there are people standing smoking, I can go and stand with them. But I still won't be tempted to take a cigarette from them or even to take one puff.
Right. And I think that just like to remind, if anybody's watching and they've tried and not succeeded, I think now there are other options available and you can take help as well, because and then, I think this seems to be a complex problem. Some people are able to quit cold turkey and others really struggle with it. So, and often when they're struggling, you need to evaluate the, you actually need counseling because you need to evaluate the psychological reasons that are holding you back, right? So, again, yeah, just letting people know that it is okay to seek help if you need to. And there are services available, even, kind of, I think the government runs a national cessation program. So there are a few options available out there. Talking of, kind of, you talked earlier of dry mouth. Did you do anything specific to deal with that? And were there other side effects as well at that time?
Dry mouth was the biggest irritant, I would say. It was very frustrating. We take saliva in the mouth for granted.
Correct.
And when it is not there, you end up taking sips of water just to wet the inside of your mouth. Then I used to suck some sugar-free, very, very, very bitter candies that would, try and activate the salivary gland. Sometimes it would work, sometimes it wouldn't. And because of the dry mouth, therefore, then you're rinsing with the mouthwash more often. I mean, it started out with mouthwash being diluted and put into one of those 10 cc syringes and actually being syringed into the mouth, because, I mean, literally, the mouth was opening probably 10% of what it does now. And you just push that nozzle in and you squirted it around and with a very weak rinse and then spit it out. And you did that maybe 3 times, 4 times, 5 times, 6 times a day, depending on what is your food intake, what was going into your mouth.
Right.
You got to rinse and flush that many times. Dry mouth took a long time to go. And I have a very healthy respect for saliva after that. Because it is such an uncomfortable feeling. And it's annoying. It's helpless. That's something that your body has to generate.
Right.
And it's not manifesting itself.
Correct.
And right through chemo, radiation, all of that, the dry mouth persisted. Even when I went back to work, I used to still have dry mouth. And I think by then I was able to start sipping more water. So I was able to keep my mouth hydrated. But that was a challenge. That was
right.
Really a challenge. Yeah.
Right. And did you need any speech or swallowing therapy or any therapy, because you said you also had dribbling?
No, I still dribble because cancer had also eaten up the side of my lip. So even the right part of my lip also had to be reconstructed. It's slightly imbalanced. So if I have to gargle, I have to stick a finger on the side here to stop it squirting out. Now I know it's going to happen.
Right.
So I know I have to put my hand here, but when you're eating and if you're, you have to be careful. I try not to wear a white shirt as far as possible because I know if I'm going to go out for a meal, I'm going to dribble and it's going to get stained. So again, it's just one of those things that it is now registered that if you're wearing a white shirt,
Mm.
you will not consume anything that is oily or liquid, because there is a more than 50% chance that some of it is going to end up on your shirt.
Mm. Mm.
So you're aware of the limitations, and
Right.
I've learned to live within that.
Right. Right. And because you did not, I think you mentioned earlier that because your larynx and pharynx were not
Yeah.
affected, you didn't need other forms of
No,
speech
I
therapy and
didn't
so
need
on.
any speech therapy.
Mm.
Fortunately, my spoken voice is still very clear.
Right.
Uh, I used to enjoy singing earlier,
Hmm.
and the fact that I can't open my mouth fully
Hmm.
definitely impacts my singing ability.
Right.
Uh, so, but okay, I mean that's something that I can live with. But fortunately, yes, speech is clear.
Mm.
So to that extent, in fact, it was very interesting that Mr. Sharad Pawar and I both had mouth cancer around the same time.
Mm.
His was on the left, his was due to gutka, mine was probably due to smoking.
Right.
But one, because he was older, and I think perhaps his healing was not so complete. Uh, you'll realize that he has a speech impediment today,
Mm. Mm.
and well, maybe with age the recovery is not so comprehensive.
Right.
But for a long time, when people ask me what I had, I say, "Oh, you know, Sharad Pawar," and everybody knew that he had cancer. Okay, yes, same thing.
Mm.
So it became a good way of explaining without explaining.
Right. Right. Um, so, and again coming back to eating, because I remember in the conversation you talked of the size of the morsel is also important. How do you
Yes.
kind of handle that?
Well, again, if I'm going to have a papaya or a watermelon, I just cut it very fine.
Mm.
So that's thin. I mean, if I have to have a cream biscuit,
Mm.
I have to separate the two halves of the biscuit
Right.
and uh, have each one individually. So if that gives you a pretty good idea that anything that's more than maybe 3 millimeters or 4 millimeters,
Mm.
it is difficult for me to put it into my mouth. Otherwise, I end up pushing it in,
Mm.
which means that the teeth are going to block it, and then you force it in.
Right.
So I tend to cut things very small,
Mm.
so that it's at a portion size that is easy enough for me to put into my mouth.
Mm.
It's like I'd prefer to eat with a teaspoon than with a normal spoon,
Right.
because that more or less gives me the correct portion that needs to go in my mouth. So I
Right.
like thin crust pizza. I don't like thick
Mm.
pizza for exactly the same reason.
Right. Um, so, and in terms of your follow-up, I know you talked of the dental follow-up. Are there other follow-ups that you do for cancer itself?
Not at this stage. I mean, it's now in my 16th year. For up till about 5 years, I used to go. First, it was once a month, then once in 2 months, and once in 3 months, and once in 6 months. Up till 5 years, I was very regular in terms of going. After that,
Mm.
I basically, I once in about 4 or 5 months, I get a whole full spectrum blood test done.
Mm.
As long as the parameters are all within range, I don't need to do anything.
Right.
I've had a couple of scares where I've thought that I've had a cancer relapse,
Mm.
and I actually prepared myself again completely for surgery and everything.
Mm.
But fortunately, I met another very good oncologist in Gurgaon, who was able to diagnose it that it was just a very, very bad infection
Mm.
that actually was so bad that it was showing up on a PET scan.
Wow.
And but he was able to treat it as a infection with very strong antibiotics for an extended period of time, and that sorted out. But let's put it this way, I went to the extent of actually getting a flap created on my shoulder. I got a chemo port inserted,
Wow.
and I was all set.
Mm. Mm.
Because again, if cancer was coming back, fine, it's coming back, it's another bump in the road. let's get it treated and let's get on with life. Fortunately, I didn't need to do that.
Right.
But
Right.
I was fully prepared that if cancer has come back, and this was 2016, 10 years. So on one hand, I was thinking 10 years is a long time for a relapse. But at the same time, I said, if it's back, and it was the same right side of my face, which again, I got up one morning, it was fully swollen and tried with antihistamines for a day, didn't work, got worse. Went to a hospital because of my history of cancer. They said, get a PET scan flashing blue all over the place. Fortunately, it turned out to be a bad infection. But
Right.
yes, I was fully prepared that if it was cancer, it has to be combated again. And I just did whatever had to be done.
Right.
Literally down to getting a chemo port inserted and getting a flap. Actually created the surgeons actually created the flap in my shoulder ready to do the next round of surgery. It wasn't required finally, but well.
Right. And before we come to the final question, one quick question: do you tell your friends or colleagues, etc., to stop smoking?
Yes, I do. In fact, most of my friends, after seeing and knowing my situation, many of them have given up. A few diehard smokers are still there. And I just tell them that, look, you could end up like me. So I'm not a very I'm very happy to share about cancer and how to manage cancer. I don't know if I'm as strong an anti-tobacco advocate as perhaps I should be. But anyone who I see smoking, I tell them what happened to me.
Right.
And I trust their intelligence for them to make their own conclusions.
True. Thanks. So coming back to the fact that, why do you talk about your cancer journey? A lot of times people say, why should we keep regurgitating the old story? It happened so many years ago. And, it's not easy to keep telling it again and again as well. So why do you do it?
I think my decision to talk about cancer came about even before I'd undergone surgery. When many of my colleagues and former colleagues heard that I had been diagnosed with cancer, of course, a lot of phone calls came. And one particular former colleague of mine, he called and he started crying that I have cancer. He's crying for me. I'm not crying. And I realized that there is so much of ignorance even amongst educated people. And there's such misconceptions that I would have to do whatever I could to correct that. And that is when, even before I'd had my surgery, I had decided that come what may, I'm going to talk about it. Once I came back to work, a lot of my colleagues were curious what had happened, how did it happen, what was the procedure, what went. Then people would come up and say, actually, I have this relative, or my mother or my father has also had cancer, because then they felt that they could confide and talk to me since I had been on this journey myself.
Right.
So I started informally talking to patients, talking to families, giving them my own, in a way you could say as a living testimony. And this is even before the 5 years were over. Then while working with the Birlas, I actually qualified as an executive coach, doing coaching and mentoring in a professional environment.
Right.
I started using that as part of my cancer story. Still very informal and unstructured.
Right.
Then, of course, I came across Vijay Bhatt and Cancer Awakens and found that we were absolutely in sync in terms of having properly formulated process working both for patients as well as for caregivers and families. And I became part of their network, and that's been very, very rewarding professionally and very satisfying, because today people are looking for something that's in that structure.
Right.
So a structured counseling today, especially amongst professionals who are used to that in their normal working life,
right,
it becomes easier for them to accept.
Mm.
So that's why I am always available to talk about anything that I have gone through. Happy to answer any questions at any time.
Right.
Based on whatever experiences I have. And I always look at it that what I am doing is perhaps supplementing what the doctors do, because most good doctors are too hard pressed for time to really get into this non-medical nitty-gritty of adjusting to life post-cancer.
Right.
So I see myself as actually an add-on to all the good work that they do.
Right.
So I'm very happy to talk about my cancer journey at any time.
Right. Right. Great. I think this has been excellent. We've had a few questions and we've taken them. And I think it's always important for, it's always, as you said, it is important for people to talk about their experiences and to, dispel the fears that are out there as well. And the fact that increasingly, people survive and live well after cancer, and it's no more a death sentence. So I think we definitely need to have more and more people talking about it. And I really appreciate the forerunners on this who have talked about their experience and shared, with no hesitations and no holds barred about their experience. So thank you, Sunil, and thank you to our audience. And I think if you ever need to connect with Sunil, let us know. We will put you in touch. And he has always been willing to talk about his journey, and he brings a lot of value in terms of how you can advocate for yourself as a patient, or for a family member who's going through cancer. So do reach out and do share this with people who may be struggling to deal with cancer. Thank you, Sunil, and thank you everyone for your time.
Thank you, Aparna. Thank you to all the viewers, both today and who will be viewing it in the future. Any questions routed through Aparna, I'll be very happy to answer them. Thank you.
All right. Thank you.